They care for hundreds of thousands of patients across Hawaii. But some doctors who are paid by Medicaid, the state's safety net insurance, misuse it as a prescription for profit. Gina Mangieri is always investigating and found out what's being done about it. Gina?
Joe, even when they're caught in suspected fraud, many medical providers get to stay in practice and keep right on collecting. And when there are crackdowns, some say they feel unfairly targeted. So I found out from the state the hurdles they go through to handle dishonest doctors. Medicaid is one of the state's largest programs, close to $2 billion a year, distributing mostly federal tax dollars to ensure care for Hawaii's low and moderate income families and nearly half of Hawaii's children.
If we are defrauded or overpayments are being made, that means in the end we are denying people the services who are legitimately entitled to it.
The Department of Human Services is making inroads against payments providers should not have gotten, nearly tripling the dollar amount over about the same number of investigations a year. Sometimes providers make unintentional billing errors.
If they are made, I must recover. I can't just let it go.
Other times it's outright fraud. Patients report something odd on their bills, services they never got, or dates they weren't there.
I didn't get the diabetes shot, or I didn't get the tetanus shot. I didn't get this screening. You know, sometimes because they do get their statement.
The state's contracted health plans check claims in their own fraud watch departments.
They say there are billing irregularities, there are anomalies regarding the usage of certain authorization codes.
And yet, even when busted, these medical providers usually keep right on seeing patients, even collecting Medicaid money.
Why still do business with those who have been caught with these intentional cases?
It's a very good question, because what happens is that when these things happen and they are found to be in violation and it's intentional, they can go on the exclusion list.
A list maintained by the feds cuts providers off from Medicaid, but despite dozens of investigations a year, only a small handful of those end up with doctors cut off.
You still have to end up paying that same person for services again as long as they're not excluded, right?
That would be correct. We have to be very, very concerned and cautious as well that we don't just simply remove medical providers from their communities.
Excluding is not DHS's call. It can freeze payments for a short while and hand findings over to the Attorney General's Medicaid Fraud Control Unit to investigate the kinds of cases that could get a provider on the blackball list. We asked the man in charge.
The exclusion list that we're talking about, again, it's any type of recommendation like that is always going to be based upon looking at the evidence that we have. You have to be able to prove that they have a certain state of mind to actually defraud the federal government. It really helps to have live people who have actually seen the fraud take place or seen the abuse or neglect.
How can you get caught doing something and still be providing the service months or years later?
Right. Well, I think, you know, when we're talking about people who are potentially being prosecuted criminally or being subject to some sort of civil penalty, you're really talking about ending their career. And so in order to be able to bring those kinds of cases, it's a very, very serious allegation that needs to be proven.
The Attorney General's office declined to prosecute criminally one of DHS's largest dollar civil pursuit cases to go public, accusations against Hilo doctor Frederick Nita.
He discovered an alarming rate of young women who were on drugs. And so he began to create a requirement for people who came to him, I will treat you, but you need to deal with the drug issue, and we're going to drug test you on a regular basis because we need to stem the tide of drug babies who are being born.
So to the state, this looked like repetitive billing of some unnecessary service?
Right.
His attorney says Dr. Nita was unfairly targeted so the state could score a big recovery. But Nita was cleared of fraud over the drug tests, and the state's nearly $2 million reimbursement issue is still up in the air. The state sued again and got a more than $200,000 judgment over specialty rates. Nita's attorney plans to appeal that judgment and says his client is a victim in a game of catch-up.
They had been lax in going after providers who were getting paid monies they weren't entitled to. So in sort of a knee-jerk reaction, the state decided, okay, we're going to start to go after people.
Do you think, meanwhile, that some other cases of fraud are slipping through because of the focus that's gone to this case?
I'm sure that's the case.
There are lots of medical care providers who are very careful about their records, who make sure that their accounting is just spot on. And so I don't actually think it's fair to just say, well, I think everybody does it.
DHS says it's keeping watch over providers with a history of questioned practices, whether or not a case ever goes all the way to court.
I think my eyes are going to be on them far closer than they ever will otherwise would have been.
The state is doing several things to prevent fraud and overpayments. Starting in July, DHS will start criminal background checks of doctors who accept Medicaid. And new automated systems cross-reference eligibility and let supervisors comb through cases quicker to send suspicious ones to the investigators. Gina Mangieri, KHON 2 News.